5 minutes after 11 o'clock. Thank you for tuning in. How you feeling?
Well, I am doing great, Larry. Are you talking to me or the audience?
Well, if you're feeling great, that's great. But if you're not, Dr. Riadh Fakhoury is here to help you out. This is the Head to Toe Care Show. If you have a question about your health, this is a good place to ask it. And it's probably the first step to getting everything fixed, because when you go to the Fakhoury Medical and Chiropractic Center, that's what it's about, is getting you back together. Dr. Fakhoury himself is a chiropractic orthopedist over there, and of course the owner of that medical center, and we'll tell you where that is and when. The phone numbers and all that. Right now, the number to speak to Dr. Fakhoury on the air is the WOCA Climate Control Source Hotline, 622-9622. Good morning, Doctor.
Good morning, Larry. How are you?
Just adjusting the
You
camera.
are just full of energy and vitality. I like that.
Oh, good.
That's
Well,
excellent.
I had to fix the camera. You're a little bit taller than John.
Oh, okay.
It's a lot closer so we can see you better now.
Okay, wonderful.
Yeah.
You know, it's great to feel good, isn't it? Thank God, it's good to have.
It is
just
good to feel
have
good.
your health and feel good, and it's so hard when you lose that health and when you're having some problems, and have some questions. Is this normal? Should I have this numbness in my feet? You know, I don't feel in my fingertips like I used to before I'm dropping things.
Yeah.
There are some times that we get these indicators that things are not right, and our human nature is to think that they're just going to go away. I'll wait it out. Eventually, it'll go away. And we know that that's not really the best thing to do. The best thing to do is to get in to whatever the scenario might be. If you have a visual problem, if you notice that your vision is hazy, if you notice that you're losing the ability to get your peripheral vision to focus on things, you need to get to an eye doctor. You need to get to the ophthalmologist.
Right.
The best in the field, get them to evaluate you, make sure that it's a simple problem and not something that might be, that needs to be addressed immediately. But we are all very tuned into our bodies and how our bodies work, because we're with our bodies from day number one. And we all know when something is not right in our body. Unfortunately, what most of us do is we do the denial thing, and we just tuck it away and say,
Yeah.
I know the fourth and fifth finger are going numb, and I feel it going towards the elbow a little bit, but I know it just doesn't feel right. It doesn't make sense. not supposed to have it, but it'll go away. And you don't really want to do that because you want to find out what is causing that numbness. There's several different things that can cause that, but it's usually very, very easy to take care of. And patients will come into the Fakhoury Medical Chiropractic Center. They'll be suffering for years.
Right.
They'll come in and they'll get taken care of. They'll get results, and they'll say, "Why, why did I wait?" And this is a call out to those listeners that if you are having a problem, it's really something that should be addressed and looked at, and not to wait. We talked about the 3-day rule.
Yeah.
And the 3-day rule is that if something lasts more than 3 days, some people wait 3 years, but if it lasts more than 3 days, you should get it checked out and make sure it gets taken care of.
Let me ask you something, if something is possible. This is from a friend, and I didn't think of it when you asked me before what we should talk about. He is 52 years old, and you may have met him. His name is Doug. And when he was maybe not even 20, he lit a firecracker and it exploded and hurt his ring finger on one of his hands.
Right.
Left or right, I can't remember which one. And at that time, his finger was numb for a while. Well, now he's complaining about it being numb and painful, and he's thinking that all these years later, whatever happened when he was a kid is actually coming back to haunt him. Is that possible?
Oh, yes. So
really?
And we've touched on that in previous discussions where somebody might get in an accident, whatever it might be. In this case, it was a firecracker. It could be a car accident, falling off of a bicycle, tripping when you're exercising, falling out of a golf cart, whatever it might be. You have something, an incident that happens to you, and you think, "Oh, whew, that was close. I'm glad I'm okay."
Yeah, right.
But you don't realize that things got shifted in your body, the mechanics got distorted, muscles are tight, imbalances start, and over time, slowly and gradually, the problems start to show up.
Wow.
And that's why we have so many people. We had a lovely young lady just yesterday that was in severe pain, who had an accident 1 year ago, and she neglected to really take care of herself, but knew that there was a problem and carried through until she had to come in because the headaches were so bad she couldn't tolerate it, and she came in tears into the office.
Really?
And so that what you say is an example with the firecracker injuring the fourth digit. Nerve endings get injured, but maybe he hurt the joint also didn't get that treated, now the arthritis might be setting in.
Ah, could be arthritis.
We'll talk about that.
Could be, yeah. All right, we have a phone call. By the way, everybody is invited to call Dr. Fakhoury. The number is the WOCA Climate Control Source Hotline, 622 WOCA. Good morning. You're on the air with Dr. Fakhoury.
Yes, my name is John Hayes. Riadh knows me well.
Hey, John.
I'm with Stanley Electric. Hey, Riadh, how you doing?
Good, buddy. How are you?
I'm doing good. The only reason I'm going to call in is I just want to let everybody know I was in a couple of accidents, my family and I, and several of the accidents that I was in actually made it to where I could not work. And if it wasn't for a continued care, not just the 1 or 2 treatments, but a continued care with Riadh and his crew, I would not be able to work. So it is important to make sure that not only that you get treated, but also that you get in and continue with treatment, because, like I said before, things do creep up, and I can go 3 months pretty much pain-free, but if I neglect it, then it comes back really, really bad. So,
Well, thank you, John, for that information. We appreciate it. How are you doing, buddy?
hey, I'm doing good.
Good.
Hey.
And I'm going to be scheduling another appointment soon.
Fantastic. And there goes one of the best electricians in town, you know?
Well, thank you very much.
Thank you, John. I appreciate you, buddy.
No problem.
Take
Bye.
care.
Just the kind of work that an electrician does, the amount of reaching, climbing, digging, and all that stuff.
Well, he's done some work for us. He is amazing, but you know, he has to get into attics. People don't realize the electricians, especially when you're building a new house, you're pulling wire, you're pulling cables. I've seen big, heavy things on his shoulder, and he's dragging him across, you know, many, many feet, pulling in unusual positioning, arms up over your head. A lot of people have problems with their shoulders and their neck. When they put their arms up over their head, their neck gets tight, their arms go down, they have pain in between their shoulders. Things that we could take care of, as John was saying. Sometimes a very, very light tune-up adjustment, especially if you've had an accident in the past or an injury and it keeps cropping up. With intermittent treatments, almost like realigning a tire in a car that wants to go out of alignment, you keep that body in a better position, it functions better, there's less pain, and you do much better. And you have less arthritis later on. For example, your friend, he had an injury, it's starting to show up.
Right.
Really didn't address it, so he didn't keep up with it. So now he may be having some wear and tear issues that could have been alleviated along the way.
Oh, and is it fixable now? And you don't know, obviously, without looking at it, right?
It's hard to say because sometimes the nerve endings get traumatized, and then later on there's a damage which will show up when you get older. Sometimes you damage an area, and when it's less resilient, it could start to show up and give you problems at a later point. But again, it's amazing the God-given ability that we have to heal and recover from problems that once people come in, even if they've had them for years and years, it's amazing their recuperative ability and what a change that they have, usually starting from the very first visit.
And it is amazing how we heal, isn't it? Don't you wish everything could heal? I was pulling on the lawnmower rope the other day, and it wouldn't start. And then the next thing I know, I've got a blister. See, I got it right there.
I see.
And look, 3 days later, it's almost to normal.
It's an
Just
amazing
one of those
thing.
amazing things.
It really is. It really is.
Now, when we take chemicals to kill pain, whether it's aspirin or something stronger, to me, that there's always a risk with it. That's why I like when you talk about the techniques you use that require nothing to be ingested.
Yeah. The simpler and the less invasive, the safer it'll be. And there are rungs in the ladder of health care, and you want to start with the simplest, most basic type of treatment that is very effective. So I would say that we could safely say we help, between 80 to 90% of the people coming in with neck and back pains at the Fakhoury Medical and Chiropractic Center with chiropractic alone. Most patients coming in will be able to get taken care of with the chiropractic alone and do extremely well with that. If that doesn't work, maybe an anti-inflammatory. Only in conditions where the pain is severe do you want to start with the pain medication, because pain medication is basically covering it up. It's not really resolving the issue, and you don't want to just put a blanket over it. Pain is very complex, and that's why patients and new people come to us with pain saying, "What's going on? Explain it to me." It's extremely complex. It's physical, it's psychological, it's emotional. There's so many components to it that we have to address stress. But so many people do well when you're doing chiropractic, which is hands-on, one-on-one with the patient, doing the mobilization. And if that doesn't work, then Dr. Shanawani is on board. There's anti-inflammatories to bring the inflammation down. If that doesn't work, and we do an MRI and see that there's a disc herniation and it's putting pressure on the nerve, then we have Dr. Hobbs, who does the interventional medicine, epidurals, facet blocks, trigger point injections. So there's a cascading, increasing type of treatment, and hopefully we can stop everybody at the most simplest and the safest effect. Because as you go up, of course, risk goes up, but we try to do everything in the safest medium possible.
Do women who have given birth to children later in life have, in your experience, have a type of a back pain that men and other women who never gave birth to children will have? Does the childbirthing process somehow cause a residual effect later in life that gives back pain?
Well, there are two things that the female that's gone through labor and has problems that I've seen in our practice. So one of them is called pelvic dysfunction syndrome, PDS, and the other one is when they have an epidural that is done quick and spontaneous. Very rarely, but when the lady is laid on her side and a quick epidural is done by anesthesiologist to give some relief for the pain, sometimes a little scar develops in there, and this, I've seen it only in 2 cases out of 26,000 patients.
Oh, wow.
So it's very rare, but maybe some listeners are there and they have this, but it's almost like a continual numbness, maybe about 4 finger widths above the belt line, and it's at the L3 area, and it's almost like a constant numbness in that area where that quick epidural was done by the anesthesiologist, during the labor process. It's rare, but we find that when we mobilize that area with chiropractic, some massage work in there, with those 2 patients, we were able to help them, because what happened is that there was an irritation and something happened in that segment and it never released. And this is what we see in accidents. Something happens and it doesn't release. It doesn't go back to the way it was before. It needs some help to go back there. And the second thing is pubic dysfunction syndrome, where the actual pubic symphysis, or the big thick disc in the front that holds the two parts of the pelvis together,
Right.
tears or shifts, and the whole pelvis shifts and rotates. It's very uncomfortable, and produces a lot of dysfunction or poor function for that lady. She has a hard time walking up steps. She has a lot of sacroiliac pain, a lot of pubic pain, sometimes some urinary problems with that. And we've had maybe about 4 patients with that come in, and they respond extremely well, but it's a slow process. It takes a long time to get the healing and recovery from a PDS. PDS is a very difficult thing to treat, but we do have the techniques, the knowledge. In fact, we're on an international board for Fakhoury Medical and Chiropractic Center with PDS and the treatment of that. So
Wow.
if the listener is either had a child and she's having a lot of pubic pain, or else she has a granddaughter or daughter that's had a baby, that maybe the baby was very large, the head was pushing on the ilium, on the pelvis,
Yeah.
shifting it, or the baby wasn't coming down properly and caused damage to the pubic symphysis. That's something that we can address and take care of.
Wow. So that'd be a great Mother's Day gift. I mean, you consider the mom, the backache you have is probably my fault because you gave birth to me. So as a thank you for that and everything else, here's a gift certificate for massage at the Fakhoury Chiropractic Medical Center.
Right, and so many things happen. People don't realize it, but during the birthing process, I have a patient who actually had a fracture of the pelvis
Oh.
from the force of the baby coming through. There was an actual fracture, and
Yeah.
she comes in now for treatment about once a month too, because
Really?
if she doesn't, her back gives her a lot of problems. But once a month keeps her where she functions with minimal amount of pain. But the birthing process, it can go smoothly, but if there's a problem, it can cause some back pain.
So think of the Fakhoury Medical and Chiropractic Center when you're thinking of Mother's Day. Not a bad idea for a gift, actually.
Actually, not. No, if for those husbands that are looking, or excuse me, this is Mother's Day.
Mother's Day. Mother's Day. Yes.
For those children that are looking for something special for their mom, then they can come into the office and they can say, I want a gift certificate for my mom, and get a 1-hour massage, and that really is something that when mom will come in, it's just a whole nother world. It's a room. It's calm. It's serene. There's some soft music, a little lamp, and our massage therapists are amazing. People just float out of the arms. After 1 hour massage, you can tell somebody's had a massage. They're just so relaxed and just in another place because they're very, very comfortable. And getting the muscles worked out, even if you don't have pain, it's such a stress reliever. So I encourage everybody to be able to get a 1 hour massage. And for those that want to do it as a gift certificate for a loved one, they're welcome to just walk into the clinic, and Amy, our patient care coordinator, can put a gift certificate together very quickly for them. It's very reasonable, and at the same time, it's a gift of health, which is remembered for a long time.
And is it reasonable for anybody? But I was going to ask if a woman, is it reasonable for her to request a massage therapist of one sex or another? Like she might be more comfortable with the woman.
Yes, and we accommodate for that. We have Dr. Kim, for example, female chiropractor that comes in specifically for some ladies that just want a female chiropractor only. And that's at the Fakhoury Medical and Chiropractic Center. That's one of our focuses, is to be as flexible as possible for the patient's needs. And there are some patients that request specifically, I'd like a male massage therapist, I'd like a female massage therapist. Then, and so we have Michael and Jeff who do an amazing job at massage therapy. All the massage therapists are licensed, and they're very well trained in what they do, because the patients have different needs, and because of that, we accommodate for those needs.
Be a good time for her to just, have a little chat and say, what else is bothering you? Maybe there's something that just never has been taken care of.
Right. And during the massage, it's a very relaxing time. And having that 1 hour for the massage therapist to work the whole body, it's very helpful.
Wow. I wanted to make sure that I mentioned it again. I've tried to do this as often as I could, that you can also ask Dr. Fakhoury questions on the internet. There's a live streaming video of this program every week, and if you go to WOCA.com, you will see the video right away. But on that site is not where you would ask the questions. On that site, you'll see the video, and on the lower, somewhere on that screen, it says Ustream, USTREAM. Click on that, and it'll take you to the host of the Ustream streaming video thing. There is a place where you can type in questions. And I know last week we had one.
Right.
So I'm keeping an eye on on it to make sure I don't miss one and to pass it along to you.
Thank you. And also, while we're live on the air, I'd like to mention a quick shout out to Ocala Palms. So
All right.
I know that quite a number of folks at the Ocala Palms listen to your show and enjoy it also.
Well, good.
So it's good to have them listening in.
And if you can't type in, you just want to call it, that's always welcome as well. The number, of course, WOCA Climate Control Source Hotline 622-9622, and headaches are that one thing that just people get them and wish they could go away like that.
You know, we've had 2 patients coming in yesterday, new patients, and by the way, when it comes to new patients, if somebody's calling, we'll see them that day or the next day, because most of the people that we see are what we call acute, which means that they are just in severe pain and it's very immediate onset.
Yeah.
We mentioned that one patient that was in an accident a year ago, and for the past 2 days before her visit, the pain was just unbearable. And another patient yesterday, 2 young ladies that came in, and you could see, because when we come in to say hello, the whole body shifts. They could not turn their necks at all. And that's because of the muscle spasms. The body feels that something is out of alignment. It feels that something is being pinched. The body will not allow motion in that area. And so they have to turn their entire torso to be able to look at you and say hello. Very uncomfortable. And muscles are just like children. If you keep them in a certain pattern long enough, they memorize that. So imagine what happens, Larry, if you can't turn your head from left to right for a week or 2 weeks. Say you get in an accident and your neck is stiff.
Yeah, not good.
Not good, because then the muscle gets short. The muscle memorizes that, and then before you know it, you have lack of motion that will carry on, and then that will be troublesome for you later on.
You know, a lack of movement of your neck might cause an accident. I didn't have an accident from this, but I had it where I was stiff neck. And you know, I'm always self-conscious of that blind spot when you're driving.
Yes.
Because the mirror doesn't see everything.
It's so funny that you say that. Just yesterday, the same discussion, the patient was in such severe pain, we actually had to put a soft collar on her to raise her head up to give her some relief from her neck. Very, very uncomfortable. And when we were talking yesterday during the treatment, she was saying, you know, doctor, I take this off when I'm driving because I'm afraid I'm going to cause an accident. Wearing this collar because you can't not turn your you can't turn.
Yeah.
And the blind spot, she was mentioning the blind spot also. She couldn't see if there was a car there. So it's funny that you bring that up.
Yeah, I learned my lesson when I was a new driver. There was a lane that was closed due to construction, and I assumed nobody would be there.
Uh-oh.
And I turned into it.
Oh, no.
And I didn't see anybody in the mirror. He was in my blind spot.
Larry.
I learned my lesson. I was 17.
Larry.
Yeah, it's a long time ago.
Okay.
That's 41 years ago.
But now you look over your shoulder, right?
Always. Yes.
Always. That's right.
Lesson
Twice.
learned, right?
Twice. That's right.
But anyway, I mean, and I've had that stiff neck thing that you were describing, and I've often thought that this is not good for driving.
You know, and that's why when we're at a stop sign or a red light, what I try to teach my children is that when that light turns green, just wait a little bit.
Yeah,
Give it
don't
2,
trust
3
those people.
seconds.
Yeah.
Because sometimes somebody is in a rush or they're not paying attention or the light catches them by surprise and they're just in the middle of the intersection. It's amazing how many accidents in the intersection that we see patients coming in for treatment. I mean, it's just so wait 2 or 3 seconds before you go. And also, when you're making that right and you're looking to the left, take a double look, because it's interesting how many patients have pulled out into traffic and they say, I never, where did he come from? I didn't see him. I looked, and I did, and I don't know why sometimes we look, but we may not, be comprehending that somebody is there. Take that second look. Take that time. The accidents happen when you lose concentration, when you're hungry, when you're rushing things up, when you're cutting corners. That's when you're gonna have. That's when you're gonna have an accident. So slow down a little bit, because we see the ramifications are. 25 years we've been treating people who've been in trauma, and we've seen all different types, and it's usually because it's an attention thing. So I would say that take the time. If the light turns green, wait 2-3 seconds. When that car whizzes through the intersection, you'll take a deep breath in and say, "Thank God I waited." And when you stop to make a turn, take a double look. Also, it's good to remind ourselves to do that. Take a little extra time, so that way when you look a second time and say, "Oh, where did he come from?" I'm glad I didn't
people can relate to this one, but I'm just curious in your practice if you've ever had somebody that had a limb amputated and they had what they refer to as phantom pain. There's no actual body part, but they're feeling pain in it.
Right.
How do you can you help that person?
The answer is yes, often, and the reason is that, and well, there's two types of phantom pains. Let's talk about the one that a few days ago a patient of mine came in. Her leg pain was severe. She has a disc herniation. It just radiates into the front of the lower leg. It's extremely uncomfortable, almost like a rope is on there and just being pulled very tightly. And she made a comment, which I've heard before. Oh, if I just cut my leg off, I won't have pain. I had to explain to her, you know, if you cut the leg off, you still have the pain, because it's called, the cause of the pain is the low back. We have to remember that the pain is not always coming from the location.
Really, isn't it?
And so it was just an education. I mean, she said that when patients are that much pain, they say things like that. Oh, if you could just remove this, I'd feel better. But really, we have to go back to the source of the problem. And this scenario is that type of phantom pain would be because it's coming from the low back. For example, I have an amputee that comes in for treatment and he has the phantom pain, but the sciatic nerve gets pinched in the back and causes him to feel the pain as if it's in his toes.
Wow.
Even though he doesn't have the toes because of an amputation. But the fibers are still there that would have fed the toe in the low back, and the pressure on those fibers sends a message to the brain that there's pain in the toes. And so we treat the back in that situation. We treat the sciatic nerve, and we treat the pressure on the nerve in the back, and that takes the pressure off and relieves the pain that they're experiencing.
Okay, I didn't know that. That's not this phone. Doctor, what is your phone number?
The number is 351-3413, and you know, many times I'm sure that people are listening and they'll have some questions, or they're feeling some things themselves personally that they want to look, have checked out, or have some questions answered, and you're more than welcome to contact the office at 351-3413. The front desk or a patient care coordinator, Amy, will answer the phone. At that point, they'll be able to help you with any insurance questions be able to help you with the opportunity to schedule an appointment to sit with Dr. Teeter, myself, Dr. Shanawani, Dr. Hutchison, Dr. Hanson, and be able to visit and answer your questions. Very thorough evaluation will be done, and then at that point we'll have a very good idea of what your problem is and our recommendations, whether there's something that we can take care of in-house or if a referral needs to be made. And we are on 17th Street. As you are crossing 441 towards 200, over the bridge, at the bottom of the bridge there's a light, and we're the tan building on the right hand side, and we're in Monday through Saturday, keeping hours convenient and available for patients.
Very good. And call us if you need any of that repeated, or go to WOCA.com and look at the Wednesday lineup for AMO Cal Live. You'll see Dr. Fakhoury's name and the title of the show, the Head to Toe Care Show, every Wednesday at 11:05 till 11:30. Thank you, Doctor.
Thank you very much, Larry. I appreciate it.
Good stuff. We'll take a little break and be right back.
Have a wonderful day. Do you wonder why you continue to experience pain? Is your daily routine affected by your body telling you that it hurts? Let us explain why this may be happening to you. Every Wednesday at 11 a.m. on the Head to Toe Care Show. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center, available to serve you and answer any questions that you may have. Again, that's on the Head to Toe Care Show every Wednesday at 11 a.m. right here on WOCA Source.
Ocala's information station, 1370 WOCA.
The weather is brought to you by myfwc.com. Life Jackets save lives. Where in Florida? Mostly cloudy today with a couple of showers, thunderstorm around through early tonight. The high today 78 to 82. Mostly cloudy late tonight, those 65 to 69. Mostly cloudy and breezy tomorrow with showers and thunderstorms, some with heavy rain. The high 78 to 82. Friday, clouds and some sun with a couple more showers and thunderstorms around 78 to 82. From the Florida Weather Center, I'm meteorologist Berg.
Hi, I'm Russ with Climate Control Mechanical Services, and I want to invite you to tune in every Thursday at 10:30 a.m. to listen to tips and answers to the many any questions you may have about your air conditioning and heating for your home or business. The climate every Thursday at 10:30 a.m. right here on WOCA.